Hey guys, Luke here from Move, Train, Perform. Today I'm just going to look at a couple of ways to help prevent or clear up a little bit of shoulder impingement, subacromial impingement specifically. It's a pretty common issue for CrossFitters or overhead athletes in general because of the demands of range of motion and loading placed on the shoulder when we go overhead with our gymnastics movements, our Olympic lifting movements and so on. If there's any imbalance in the range of motion or the control stability at the shoulder joint, it's very easy for structures to get jammed up or trapped and some inflammation to occur, and then that to flow into pain on everyday activities. So what we're looking at is we're going to go through a couple of mobilisations to start with to clear up some less commonly addressed areas that will affect or contribute to shoulder impingement. So the main players in terms of mobility for shoulder impingement that people don't often get to are the internal rotators of the shoulder joint. So the internal rotators of your arm. Now, the subacromial space, the area we're talking about that gets jammed up, is this gap here above or between your upper arm, which is your humerus, this is the humerus, and the top of your shoulder blade and the clavicle here, where it joins up together. So this little space here, little gap, there's your supraspinatus comes through, your long-headed biceps comes up, there's some bursas, which are like friction buffering structures that fit in there, and if they get jammed up against, they can get a bit irritated and inflamed, and it continues to narrow the space down, and it hurts. So what we want to do is make sure that your positioning in the socket, your upper arm positioning, isn't oriented in a way that's going to contribute to jamming. And so when you internally rotate, or if you start from an internally rotated position because of tight structures dragging you in that direction, then it's going to increase the likelihood of a pinch. So the tissues that we're going to look at today are going to be teres major, which is one of the internal rotators. It's like a little lat, so it runs from the edge of your shoulder blade in here across to the front of your upper arm, and it rotates it internally. We're also going to look at subscap, which sits on the face of your scapula and comes up and attaches to the front here as well and helps activate to internally rotate. Another one that often contributes is the lat, but it's pretty well mobilized area. It's a pretty common place to stretch out, roll into with a foam roller, a lacrosse ball, or stretching with a band. The other two areas, subscap and teres major, aren't so common, so we're going to look at those ones today. So what we're going to do is we're going to start with the teres major at the back of the shoulder here. It's important when you try to mobilize an internal rotator that you wind your arm into external rotation. That way you're putting that the muscle that drags you into internal rotation onto stretch, and then you mobilize it. Vice versa, if you wanted to mobilize your external rotators like teres minor or infraspinatus, then you'd want to wind up into internal rotation and mobilize there. Okay, so for today we're going to external rotation, pin it, and then stretch through range. So we're going to use a lacrosse ball. We're going to get that lacrosse ball in the back of the shoulder, up high near the head of the humerus, up high near the top of your arm, and just against the edge of your shoulder blade. So feel your hand around till you can get the edge of the shoulder blade, and you're going to sit the ball in there, and we're going to lay on our side. So I'll keep this chair out of the way. So you've got the ball just to the side, just to the edge of your shoulder blade near the upper arm. Lay flat on your side and cradle that arm into external rotation. From there, you just gently sweep the arm up and down through range, just stretching it out, stretching it out. You want to continue for about 2 minutes, just tacking up and down. Move around, make sure you don't get off the ball too much this way. It can be pretty sensitive in there in certain spots, so make sure that it's nice and side on and perpendicular, and you've got that arm wound up into external rotation as you stretch through range. Okay, so we're going to go 2 minutes hitting on both sides. Then what we're going to do is we're going to get a broomstick to get into subscap. Now subscap, it's one of those areas that, you know, up in here, up underneath, deep under your lat, on the face of your scapula, clinicians, physios, chiros, osteos, ART specialists, they'll get in there and release it off, and it'll make a change straight away, but you can do some of it yourself. It's not as specific when you do it yourself, you're kind of just hitting into that general area. So we're going to use the broomstick, use the rounded end of the broomstick, because use the flat end, it's a little bit painful. So go rounded end of the broomstick. You're going to get that broomstick and go in behind your lat, high up on the armpit, hand behind your head, and just grab the lat so it's nice and snug, you can't move on it. Get lots of load in on that, and then just tack side to side. So you can wedge this up in on a box or against the wall, or do it in standing on a windowsill, so you can get lots of pressure and kind of lean in on that and then tack around. Then what you can do, so you go 1 minute to 2 minutes here, just kind of stripping open any of the connected to the fascia, that nasty tissue that gets matted down and will drag you into internal rotation. Then what we're going to do is go through the active release movement of it. So you're going to go back into the top of the armpit there, try and buffer up against the front edge or the face of your shoulder blade, drop your arm down by your side, hold that pressure on the stick and a little bit of downward pressure. Then just sweep your hand up overhead. So your downward pressure, sweep the arm up overhead. Down, sweep the arm up overhead. Okay, so you go 1 minute to 2 minutes on there. So both sides. And what that's going to do is it's going to clear up any of this resting internal rotation this way, or some of this resting internal rotation. So it'll allow you to be in a better position here at the shoulder to start with. So when you raise the arm up overhead, you're not getting stuck into these internal rotated jamming positions. And hopefully we can clear up some of that shoulder impingement, some of that nasty pinching, aching sensations, and prevent it escalating into something more serious. So mobilise, a couple of minutes underneath with the hand behind the head, subscap, a couple of minutes sweeping the arm up overhead with the broomstick, and 2 minutes on each side with the arm in external rotation, releasing off teres major with the ball on the floor.